What better person to talk about exercise and women's health than a guy? Chapter number 18. This is going to be exercise and women's health. So, we're going to be looking at three major aspects here: pregnancy, osteoporosis, and going into a little bit of the female athlete triad. We've already gone over it before previously in another chapter, so we're not going to go too far into detail about it, but we're going to cover it at least a little bit. So some different aspects of the pregnancy, some precautions, some issues that could maybe come about with exercise, and some safety concerns, as well as the contraindications of exercise during pregnancy and osteoporosis and some of the issues behind it, who might be more susceptible to it. And then the female athlete triad, and getting again into a little bit of it. We're not going to go too far into detail about it because we've already gone over it previously. So hope you enjoy the chapter. It's a fairly short chapter again, but hope you enjoy it. And if you have any questions, hopefully I answer them during the lecture or afterward. But if you don't, you can go ahead and email me or do whatever you want to do. Contact me somehow, I guess. So enjoy the chapter. Chapter 18, Exercise and Women's Health. Some health conditions with a focus on females. Now, pregnancy isn't necessarily a health condition. There could be some health conditions related to pregnancy, but it is taxing on the health and on the body itself. So it is something to look at and keep in mind when looking at the health of a female and looking at physical activity that they're trying to perform if they are pregnant. Osteoporosis, it's not very specific to females, but they are significantly more likely to develop osteoporosis or osteopenia. And following up then towards the end of the chapter with the female athlete triad, which we're not going to go too far into detail in this chapter. We've gone into detail in other chapters. Now, the potential benefit of exercise during pregnancy, the psychological well-being. Again, with everybody, the psychological well-being is improved with physical activity, with regular physical activity. There tends to be less fatigue as they go along in the trimesters. Shorter and easier deliveries are common in women who are physically active during pregnancy. Also, the gestational weight gain tends to be less, and there's less likelihood of developing gestational diabetes, which can be risky for not only the mother, but also the baby. Exercise and pregnancy, and some of the potential problems that could occur. Looking at heat dissipation, number one. Excessive heat may actually cause developmental defects, especially to the first trimester fetus. Now, the increase in blood flow should provide adequate heat dissipation, however, and there's also an increase in skin blood flow, which helps to aid body temperature regulation. Now, the act of sweating actually begins at a decreased core temperature as pregnancy progresses and thermoregulate the body. But it is one thing to keep in mind is the heat dissipation is somewhat taxed during pregnancy. Oxygen delivery, there's an increased blood flow and also decreased vascular resistance that allows for an increase in cardiac output and oxygen to the baby. So oxygen supply is kept constant under reasonable intensities, not full-on maximal exercise intensities, however. Now, the fetal heart rate is moderately affected by exercise, if any at all. It's not affected a whole lot. Looking at nutrition supply and premature deliveries, there's an additional requirement of about 300 kcals per day, and the energy balance and exercising mother is going to be the key factor here. Getting enough calories to support the growing baby, but not so much where they are gaining a massive amount of weight, but also keeping up with the nutritional supply that they need if they are physically active. There's no link between the length of pregnancy and exercise status, at least in normal pregnancies. The key factor here is trying to avoid contact sports that may lead to injury of the baby and cause a premature delivery, or even worse, maybe death. Looking at the exercise testing during pregnancy. So try to avoid maximal exercise testing of these individuals unless it's absolutely necessary from a medical standpoint, such as maybe in a stress test. And also terminating submaximal testing at about 75% of the heart rate reserve based on the Carvonen method if specific information is required for exercise prescription. Moderate to vigorous activity is safe for previously active women. If they were overweight or obese and inactive, they can perform some light intensity activity and they should be safe. And returning to exercise postpartum, about 4 to 6 weeks after vaginal delivery, starting slow, low intensity, and then building back up, and then a little bit longer, 8 to 12 weeks after cesarean delivery. In the chart below showing the frequency, intensity, time, and type or fit So 3 to 4 days per week, moderate intensity, that RPE based upon the Borg scale, 12 to 14, and building up to about 150 minutes per week, including a warm-up and a cool-down is important. And the type of exercise, some type of rhythmic and dynamic activity using large muscle groups. Some precautions when females who are pregnant are exercising. So trying to avoid exercise in the supine position after the first trimester could lead to injury of the baby. Avoid heat injury and drinking water, making sure that there is plenty of fluids available and not becoming dehydrated as well. Limit exposure or risk of falling in any type of impact injuries and any impact activities in sports. Being aware of increased joint laxity that could develop as the pregnancy continues. Then engage in exercises to strengthen the pelvic floor, such as the Kegel exercises. And avoid extreme air pressure changes. So going into hypobaric versus hyperbaric conditions. Warning signs to stop exercising, obviously any type of vaginal bleeding, any dyspnea or overexertion and labored breathing, dizziness, headache, chest pain, or angina, any muscle weaknesses, not necessarily soreness like DOMS, but muscle weakness overall, any calf pain and swelling that is occurring could be a form of claudication as well as pooling of the blood, any preterm labor that's occurring, decrease in fetal movement, and any amniotic fluid leakage as well. So all of these are signs to stop the exercise and go to a medical professional then. In switching gears to osteoporosis, again, a little bit more common in females. Bone mineral density of 2.5 standard deviation below the mean is what is considered osteoporosis. But keep in mind, this 2.5 below the standard deviation is the same amongst all age groups and also races. It affects a little over 10 million over the age of 50 in the United States, and another 43.4 million have osteopenia, which is low bone mass, which is approximately 1.5 standard deviations below the mean. Some common sites for osteoporotic fractures, the hip being the biggest one, also the vertebrae, and the wrist. How this is measured is through dual energy X-ray absorptiometry, or the DEXA scan that we've talked about in the body composition. This gives us the bone mineral density and gives us the mean and also the standard deviations to be aware of. Risk factors for osteoporosis include being female, older age. 1 in 3 women over the age of 50 will have a fracture that is related to low bone density. And one of the reasons for that is because of the estrogen deficiency, especially after menopause. This is responsible for 3 to 5% drop in bone mass each year after menopause. And those women who are low weight or have a low BMI. So they are considered underweight. And some of this is also related to diet and lifestyle and physical activity and possible eating disorders, which we'll see here in a minute. So diet low in calcium, estimated that about 25% of boys and also 10% of girls achieve the recommended daily calcium levels. So again, it's just not females. It is also males that don't get enough calcium and could be at risk for osteoporosis, but it is more common in females. Other factors can include alcohol abuse, inactivity, muscle weakness, a family history of osteoporosis, as well as smoking, and a history of fractures of that individual. Now, just because you've had a broken bone doesn't necessarily mean you're at risk for osteoporosis, but the reason you had the fracture could be because of low bone density, and that's the risk factor. So some guidelines for adults who have osteoporosis. The frequency being weight-bearing exercises 3 to 5 days per week, resistance training 2 to 3 days per week. Again, the weight-bearing aspect is the key factor here in increasing stress and strain on the bones to help build them up stronger. And the intensity. Moderate intensity aerobic exercise is about 40 to 60% of the heart rate reserve, or somewhere between maybe 12 and 15 on a Borg scale. Also, moderate loading force for resistance exercises, maybe 60 to 80% of 1 repetition maximum for 8 to 12 repetitions. And the time, 30 to 60 minutes per day of combined moderate exercise and load exercise or resistance training. And then the type in weight bearing and resistance training. And the third health concern we want to look at is the female athlete triad. So these are interrelated components, being the energy availability, the bone health, and also menstrual status. So the energy and availability, we're really looking at the low energy intake or the inadequate nutritional density. which is seen a lot in anorexia or bulimia nervosa, which then leads to amenorrhea. That amenorrhea then can cause a decrease in the estrogen, which then can lead to bone health issues, osteopenia and osteoporosis. And the amenorrhea itself is a disruption of the menstrual status and a depiction of the female athlete triad, in which we have the low energy availability with or without an eating disorder. It doesn't have to be an eating disorder, but it can be. Bulimia and anorexia are the most common. And then there is a disruption of the menstrual cycle and osteoporosis that can be caused because of the low energy and low nutrient availability, as well as the hormonal disruption with amenorrhea. So really trying to get optimal bone health through regular physical activity and also nutrient availability. And we want to get to this point with the treatment that there is optimal energy and nutrient availability, regular menstrual cycle, and optimal bone health. All right, that was chapter number 18, Exercise and Women's Health. You may see me sometime soon. Welcome back from the lecture, talking about women's health and exercise. And we went into the three major aspects there: the pregnancy, the osteoporosis, and the female athlete triad. Some precautions and some things to look out for with the pregnancy. Heat dissipation being maybe a little bit different, a little bit taxed, potentially making sure that enough fluids are being taken by the female. Also, probably the main recommendation there is trying not to have any type of contact sports. That should be fairly obvious, but it does need to be stated because there's some strange things that go on, and things that you put in the body could have detrimental effects on the growth of the baby as well. Any alcohol or tobacco or nicotine or anything like that. So keeping in mind that those are also recommendations that maybe we didn't go over too much there. So, but the one thing about exercise and pregnancy is that a lot of women will go through their entire pregnancy and be exercising pretty much almost every day on a fairly regular basis. Now, there's going to be some limitations that they have, obviously, and there are recommendations of trying to keep their heart rate somewhere between, usually it's like 130, 150 beats per minute. I think on average, or somewhere right around 130 beats per minute, especially as they get later and later in the pregnancy. So just being keeping that in mind and contacting your doctor just in case that individual is going to be planning on exercising, and if they're going to be doing any type of really strenuous exercises and somewhat vigorous exercises, and even some type of lifting. Now you see females performing weight training exercises, and they are perfectly fine. So just be aware that the women probably should contact their doctor and be in communication with them while they're doing some of that stuff, or if they're preparing to do some of that stuff, just to make sure that everything is fine there. And if there's any issues that could be arising during the pregnancy. And switching gears to osteoporosis, it affects men and women, but more likely it's going to affect females. And more often it does, especially as they get older and older, and postmenopausal females tend to have more prevalence of osteoporosis, or at least osteopenia. And those are going to be determined by a DEXA scan. The DEXA scan is really the gold standard for determining if somebody has osteopenia or osteoporosis, and it's based upon the standard deviations of bone mineral density amongst the females and males in different age groups and things like that. So DEXA scan, that's where it's at. That's where it needs to be. It's really the only, it's not necessarily the only way, but it is one of the major ways to determine. It's the gold standard way of determining bone mineral density and if somebody has any of those conditions. But the intake of calcium, the phosphorus can affect that, and any weight-bearing exercises are going to help to improve bone mineral density as well. And then going into the female athlete triad, that was kind of the next thing, and that's related to osteoporosis. It's one of the parts of the triad there. The intake or the intake of calcium and any nutrients. So there's a decrease in the nutrient intake. Likely there is going to be a eating disorder, bulimia nervosa, or anorexia nervosa. And sometimes the individuals can go back and forth between the two as well. And then causing maybe some hormonal issues with that, leading to a decrease in the bone mineral density, and the decrease in the nutrients are going to cause potentially osteoporosis as well. So there's a psychological aspect to that that's not necessarily part of that little triad, but it is an important aspect of getting the person healthier and getting them kind of out of that disease or issue that they have.
So again, that was chapter number 18, Exercise and Women's Health. I hope you enjoyed it. And if you have any more questions about women's health, go make sure you talk to a guy, okay?
I'm just joking. There's a lot of guys who know a lot about women's health and are really considered experts. And there's doctors in this, obviously OBGYNs and everything. So, but being an exercise professional, you need to know some of the women's health, especially if the individual is pregnant and if they may have some eating disorders and things like that, and how that can affect the bone health and all that. So anyway, thank you for watching. If you have any questions, you can leave them down below, or you can email me or do whatever you would like to. So I thank you for watching and take care.